Big bad wolf, you came prowling round my door tonight. However, let me in, 'cause I've got such an appetite. I said no, you lost your cool and lay off your fly. Or you can blow, blow, blow like a hurricane. You can't knock me down, no matter how you rage. So blow, blow, blow yourself away. I tried to talk some sense to you, but I didn't dare. 'Cause you huffed, you puffed, and you stopped.
So my name's Maggie or Margaret Cary, and I trained as a physician. And I've had just about every kind of job there is to do in healthcare. I remember the Clinton administration, chief medical officer of a $200 million ad agency, in a medical device startup, had my own practice. And throughout all of that, I've watched as communication failures are really the part of healthcare that could mostly be fixed, whether it's a communication failure between doctor and patient, or now increasingly among providers. So I am now an executive coach. I work mostly with physicians, and my job is to really be an honest broker, an honest observer with them. It's sort of like in medicine we have a thing called curbside consults, which is where one doctor, often a primary care doctor, says to a specialist, I got a patient with X symptoms, what do you think I should do? Now in the old days this happened a lot. It doesn't happen so much anymore, things have changed, but your coach is really your curbside consultant for management issues. Here's the secret. In medical school, we weren't trained to play nicely in the sandbox with each other. So what I often do is physicians who are very good clinicians are sent to me, and my job is to help them to learn how to communicate better with people, to learn how they show up, how people perceive them, how to manage their own emotions, how to recognize emotions in other people, most importantly, how to listen. Because we physicians don't need to listen. We are the experts. We have the answers. We know the tactics. We know what to do. Don't bother us. We've been to medical school. Thank you very much. But as healthcare is changing, because of the Affordable Care Act, we're going to start to be paid on results and paid on our ability to work together as a team. We're not going to be paid on, hopefully, on the piecework, which is the longer the incision, the deeper you go, and the more you take out, the more you get paid. We're going to be needing to look at new methods of payment. And that's where my work comes in, where I work with doctors as a coach. I do trainings for increasing your emotional intelligence. I talk about how you can use your stories, to improve your communication with the audience. Doctors sometimes have a tendency to have 96 slides, PowerPoint slides, and a 15-minute presentation with their back to the audience and a laser pointer going like this. But what I work is to teach them how to be better communicators. What I love about XX in Health is this is truly a place for women of all ages, all backgrounds, a place to be to get honest feedback, a place to be to really listen to other people and their stories and learn lessons from them. And I thank everybody at Rock Health and at XX in Health.